In this video, we're going to talk a little bit about the rebuilding to maintenance phase. Now, maintenance phase is a little bit of a misnomer. You're always going to be rebuilding. You're always going to be damaging. That's the nature of an injury. If you've got a bad shoulder, no matter what you do, you're going to have to take care of it. You're going to have to think there are some things that you should be doing and some things that you shouldn't be doing. With a back injury, with a neck injury, with a knee injury, chances are you shouldn't be lifting a 400-pound piano and not expect to pay for that in pain. So you need to definitely consider things like that in maintaining your pain-free status. But again, we're going to help you every step of the way. Our treatment will be here to help you if you run into any snags. Our advice and our guidance will be here to help you along the way through the clinic and through our Facebook group that you're now in. So if you have any questions along the way that you need to field, then feel free to put them in the Facebook group. Feel free to ask your practitioner. We're always available to help make sure that you're healing as fast as possible. Now, let's get back to this maintenance phase. What's happening? Well, what's happening in this phase, now that you've reduced your inflammation, now that you've made your tissues a little bit more flexible, a little more elastic, now that you've started to increase the hydration in the disc and rebuild some of that space lost, what's happening now? Well, some of the collagen, so the tissue that creates the disc, is rebuilding with the help of the laser and with the help of the lack of pressure on it from decompressing and axially stretching, removing the pressure that was creating the damage in the first place. Now, collagen as a tissue doesn't really develop all that quickly. When you take the pressure off of it and stop damaging the area and influencing it with the circulation provided by laser, it will help rebuild and repair to a certain degree by something called type 4 collagen cells. We don't really need to get into that in detail, but just know that there are a number of physiological changes going on in the tissue that was healed to improve the healing and improve its condition. And that's really what we're working on here. Going forward, if you want to do maintenance sessions, which are most often recommended, that will keep the flexibility at the level that it's at throughout after the intensive care plan, part of the plan. The other thing is it will keep the inflammation reduced because you're keeping that circulation open, you're keeping everything stretched out, you're keeping the pressure off. So a certain degree of maintenance will actually help the problem from returning. And that makes a lot of sense as well. Physiologically, let's talk about going to the gym again. If you want to stay fit, what do you have to do? You have to continue to be active. Now, you may not have to be continuing activity that you would have needed to lose a whole bunch of weight. So 5 to 6 visits a week to the gym may be what's required to help lose weight. You may be able to maintain that on 3 visits a week or 2 visits a week and just maintaining an active lifestyle. Those type of things with the body are very important. You need to maintain some type of stimulus that helped you achieve pain-free status to continue that pain-free status. Some of you, it may just be remaining active, because if inactivity caused your problem in the first place, then stay a little bit more active and the muscles and tissues and everything will remain hydrated, they will remain circulated, and they will remain strong. Your doctor can discuss maintenance with you and decide what is best for your case. It's always an individualized program. But make sure that you maintain some type of maintenance to your problem, because we sure don't want it to come back. So thank you for watching. Again, if you have any questions, please feel free to post them in the group or ask your doctor. We're always there to help you. Be patient with your body's healing process, and it will be there for you for years to come. Thanks so much for watching, and look forward to hearing your healing story.